My name is Dr. Odunsi, and I'm a board-certified OBGYN. Today, I'm going to share the most effective treatment options for urinary incontinence and how to improve your quality of life if you have it. In this video, we'll talk about the types of urinary incontinence, some of the causes, and some of the treatment options. There are different types of urinary incontinence. The first is stress urinary incontinence, then there's urge urinary incontinence, and then there's mixed, which is a combination of both. Let's start with stress urinary incontinence. The definition of this is where there's the involuntary leakage of urine with an increase in abdominal pressure. You may have seen commercials where they're talking about laughing, sneezing, coughing in patients who are lifting weights or have chronic cough. So anything that increases that pressure in that abdomen is going to increase that pressure on the bladder, and that's how you get stress urinary incontinence. Let's go into a bit of anatomy. Stress urinary incontinence is caused by weakness or damage to the pelvic floor muscles or the muscles around the urethra. I explained the pelvic floor muscles like a hammock. They're going from the front of the body to the back of the body, from the pubic bone to your tailbone. So what's happening is there's damage or weakness of those muscles, and the urethra, it passes through that hammock, and those muscles are normally tight around the urethra. That's how you don't have leakage when you're going through your day-to-day. Throughout different phases of life, whether it's pregnancy, delivery, postpartum, menopause, any pelvic surgery, those can all disrupt or weaken the tissue surrounding the urethra and those pelvic muscles. The treatment of stress urinary incontinence, first line is pelvic floor physical therapy. What does that mean? They're exercises that patients do to increase the strength of those pelvic floor muscles. It's similar to working out any other muscle in the body. Those exercises are called Kegel exercises, and you're tightening and relaxing the muscles of the pelvic floor. The way I have my patients do this, as opposed to scheduling an appointment with a physical therapist, which you definitely can do, is at any red light, just do that. Do the Kegels. Even now, I could be doing it. You want to be at a red light and you're like, oh, Dr. Odunsi said to do Kegels. So you tighten up, try and hold as if you're about to urinate, and then you relax. And that's a good 10-15 seconds before the light changes. So just do Kegels at red lights, and that should help. If you want the more formal approach, you can talk to your OBGYN and do pelvic floor physical therapy. They can guide you on how to strengthen those muscles as well. Other options include a pessary, a silicone or plastic device that's inserted into the vagina, and it helps to support the bladder. It helps to put a little bit of gentle pressure on the urethra so that you're not leaking at random times. The next form of treatment could be injection of collagen around the urethra, and that acts as a bulking agent and also decreases the amount of incontinence. The next thing a person could try would be surgical options. As with any other surgery, there are risks involved, and the surgery that could be done could be a sling. And a sling, again, it's to mimic that supportive measure of supporting the urethra so that you don't have incontinence with increased intra-abdominal pressure. Another option, especially if you are in the postmenopausal phase, would be topical estrogen, which can help with incontinence. Let's contrast that to urge incontinence. You may have heard this as overactive bladder. It is that sense of urgency that I need to go to the bathroom right now. What's happening with urge urinary incontinence is the muscle in the wall of the bladder is overactive, the detrusor muscle. It's a bunch of fibers that crisscross, and the reason why they crisscross is they're able to expand and fill and hold a lot of urine. With overactive bladder, it doesn't matter how much urine is inside the bladder, you just gotta go. And you can't time it. It just happens randomly. Who's at risk of having overactive bladder or urge incontinence? We see this in patients who take alcohol because those are inflammatory. We see it in patients who have diabetes, neurological disorders or diseases such as muscular sclerosis, a spinal cord injury, or a history of a stroke. Let's talk about the treatment options. We'll start with the most conservative and then to the less conservative. The first would be, let's change our lifestyle, avoiding or decreasing caffeine as well as alcohol. If you are a diabetic patient, to get the diabetes under control, that could improve the incontinence. Other modifications we can make, it's called bladder training, where you're setting times for when you're going to go to the bathroom bathroom. Over time, we're increasing the interval between going to urinate. The next is to have exercises you can do to stop the urine from flowing in situations where you need to have control. It could be breathing exercises. It could be tightening up those muscles and using those to stop the urge. The next, we have some medications that we can use. The first is oxybutynin. And what that does is it helps with those detrusor muscles so that they can relax. And then we have other options such as botulinum, which can help. If you have urinary incontinence, I don't want you to be embarrassed. A lot of patients don't bring this up with their physician, but we want to know this information so we can help you and improve your quality of life. Patients with urinary incontinence suffer from depression. They feel shame. They feel like they need to isolate themselves from society. There's the financial strain of having to purchase diapers, pads, or extra supplies so that they can manage this incontinence. We want to help you as OBGYN, so make sure to schedule an appointment with your physician so we can go through the different options with you and find something that works for your lifestyle. If you like this video and discussing women's health, make sure to subscribe to this channel.